Diabetes mellitus, one of the most important public health challenges, has more than doubled and is soon expected to affect over 500 million people. That's over 10% worldwide. Diabetes has no cure, takes a life every 6 seconds, affects 21 million live births, and causes 1 million amputations each year. 60% of diabetics have neuropathy, and lifetime incidence of foot ulcers among diabetics is as high as 1 in 4. Welcome to a brand new day. We are the Step Ahead project team: Craig Nicholas, Kathryn Jasper, Komal Nathani, and Juan Herrera. Step Ahead equals a mobile-friendly patient engagement platform for early detection, diabetic foot care education, and best practices for prevention in Sri Lanka. Research shows that type 2 diabetes is reduced by up to 80% by lifestyle, meaning eat smarter and move more. We all need someone that can act as our mirror and help us see things that we might not otherwise see, do what we might not otherwise do, and hold us accountable to those purposes that we have set. Prevailing foot scanning technology shows promise, like how Dr. Thusita Kahadua Darshana has won the General International Award for inventing the Footy Machine, a handheld diabetic wounds monitor capable of diagnosing any wound condition that doctors may use to cure the wound, even foot conditions where sound neurological assessment is otherwise difficult. Doctors Thayavisam Gobishanger and Jared Howell mention how, as good as offloading and foot screening devices may be for early detection and mitigation, they are limited in their approach to the diabetic foot problem. Patient education, lifestyle monitoring, and treatment follow-up are best practices to reduce risk factors. Creating a culture that engages best practices shows the most effective promise for social change to prevent the incidence of diabetic foot complications much earlier and in greater numbers than any device may amount to. Any technological improvements to foot offloading and screening may work better in concert with ongoing patient engagement. Gamification will magnify patient consciousness for optimal results by creating conversations. Who is your mentor? Accountability partner. How is that working? Do more of this. The challenge in Sri Lanka, which has 5,000 to 6,000 amputations every year, and for the remaining 300,000 that have diabetes in Sri Lanka, the 45,000 affected by foot wounds there, and in many other developing countries, is in part a logistics challenge. There is a small ratio of trained specialists that much of Sri Lanka can overcome the logistic challenges to even get to for more of that to happen. Those with diabetic risk factors may now have mobile access to diabetic foot care and education, early diagnosis and best practices for prevention, improve health outcomes, decrease incidence of foot ulcers and need for amputations. We are targeting partnerships with 615 government hospitals in Sri Lanka. We are in talks with Dr. Gobi's Jaffna Teaching Hospital and local diabetic foot care clinics on how they may partner to use our application as a tool for mutual objectives. We will use partnerships like these to target their constituents. On an individual basis, get the general diabetic population of Sri Lanka using our application, offering badges and incentives for use. On clinic visits, placing our application step ahead in waiting rooms in the form of kiosks or tablets for patients to use while waiting for the doctor. And physicians may use and offer Step Ahead as a patient resource. We're looking at Sri Lanka, and beyond to South Asia. Our platform provides solutions. For patient users, StepAHEAD offers a lifestyle and health gamification scorecard on how well they engage in healthy steps to stay ahead in their care plan. Triggered alerts via scheduled push notifications on which steps to take for better foot care, diabetic foot care education and diagnostic protocols, and diabetic foot screenings to make users more aware of how they are tracking toward their progress. For diabetic foot care centers, StepAHEAD offers a green revenue and sustainability scorecard for how much time and overhead costs are captured from previous intake process that now goes to revenue. Patient intake kiosks or tablet that enable care teams to focus more on delivering care to more people. Diagnostic foot screening and health tracking. Patient engagement on best practices for diabetic foot care. Overcosts may be shifted to care activity. Platform for monitoring patient engagement and education may enable your team to help more people who have logistics challenges of getting to care facilities. Track and achieve better outcomes for those with diabetic foot risk factors. Sri Lanka has a high literacy rate among a population that averages at least one cell phone per person and at least one smartphone per household. We're going to leverage existing infrastructure of that widespread mobile technology. Language throughout the application is in Tamil, Sinhala, and English. StepAHEAD delivers diabetic foot care to those with logistics challenges. It enables clinicians to focus on patient care and engagement. We leverage diagnostic protocols and documented best practices to benefit patients and users by awareness through education of diabetic foot care, early detection of conditions that lead to diabetic foot ulcers, alerting users to seek diabetic foot care if needed, offering a list of local diabetic care centers, engaging users in effective steps proven to have a high correlation with better outcomes that improve their condition, providing answers to their questions, enable doctors and medical care teams to track protocol compliance, and streamline communication between care teams and patients. We are the modern-day Nehemiahs of the multidisciplinary StepAHEAD project team, building our patient engagement platform, leveraging the following development technologies: HTML5, CSS3, JavaScript, PHP, Firebase, Google API, Twilio, Amazon Web Services, GitHub, and Slack. We found a lot of good questions we are incorporating for diabetic foot screening. Application development is a part of our next steps, and we intend to incorporate a standardized ranking system with consultation by physicians and podiatrists. We intend to document the risk and have market-driven feedback mechanisms. We intend to create champion badges and rewards for those who we intend to create health champion badges and rewards and other engagement incentives. We got help from those who know the language of Tamil to refine translations from translation algorithms. Our marketing campaign will be directed with primary care physicians and the general public. Our proof of concept will build on our project objectives to show a user-tested scorecard of foot health champions and ambassadors in time for our marketing campaign, community events, World Diabetes Day, World Foot Health Awareness Month. What we learned from our research is how powerfully our mobile-friendly patient engagement application, StepAHEAD, will make a big impact on the overall local and global health through early detection, education, and prevention particularly in Sri Lanka and in other nearby South Asian countries, and how patient engagement innovations from our minimum viable product is used for social change.